Hey guys, this is Tamara coming back at you with another video. I figured that maybe today we'd talk a little bit about what makes a trauma therapist different from a typical therapist. I've gotten a lot of questions lately about the differences, and so I figured that I would give you a couple of differences so that you'll have them and so that you'll know what you need to look for in a trauma therapist. So the benefits to you in this video is that you get a chance to review some differences between a trauma therapist and a real therapist. You also get a chance to define what a trauma therapist is. So those are the benefits to you today. If you'd like to see more videos like this, I encourage you to hit the subscribe button on this side, I believe it is, so that you can get updates every single time I post a video on Mondays and Fridays. And we're usually talking about things that my clients bring up in session, or we're talking about something that someone has emailed to me or has texted me or tweeted to me. So I really do listen to you guys. So if you have some information or some input, feel free to give me a message. All right, guys. So and I'm going to post all my information at the end of the video as well, so that you can go to my website and all that kind of stuff. All right, guys. So the first thing that makes a trauma therapist different from a real therapist is that they have specialized training. I think it's important to highlight that specialized training includes a set of criteria that you have to meet to have a certain level of knowledge, right? So a specialist is somebody who has not learned about everything, but somebody who has learned about a very narrow topic, and so therefore they become the expert on that topic. So let me give you an example. So let's say you have a child who is going through divorce, or you're going through divorce and the child is going through it with you, and they're struggling with depression and anxiety. They were perfectly fine before the divorce, but let's say now that the divorce is occurring, you're starting to see outbursts and anger and opposition and substance abuse and risky behaviors. The last thing you want to do is go to a general therapist who has rarely worked with kids, who rarely understands anything associated with kids, that has no experience administering tests and assessments to kids. That's the last thing you want to do, right? So you want to go to the internet or your yellow pages or your white pages or wherever a directory is, and you want to specifically look for a child and adolescent therapist. Once you find that child and adolescent therapist, then you want to narrow it just a little bit more to divorce, okay? So the more you hone in on specific skills in your therapist, the better treatment is going to be. So my overall suggestion, if looking for a trauma therapist, is to find a trauma therapist that specifically has the amount of tools and knowledge needed to deal with the problem. All right, so someone who's certified in trauma therapy, such as myself, I've had a very narrow view of that particular subject. And that kind of makes me the expert, right? Because that's all I know right now is trauma therapy, right? I don't know family therapy. I don't know dialectical behavior therapy. I don't know, some of those other therapies. What I know is cognitive behavior therapy and trauma therapy. Those are my two specializations, and existentialism, of course. So you want to have a therapist who is specifically, oh my God, it's been a morning, I apologize, specifically certified in that issue that you are dealing with, okay? The next thing that makes a trauma therapist different from a general therapist is that not only have they been trained to utilize certain principles, but they have also been trained to put on a certain set of glasses, right? They know how to see you through the eyes of trauma. When you have a general therapist, they're just kind of all over the place trying to figure out like what's going to fit, what's going to work. You don't want that, right? You want a therapist who is going to put on their trauma lens and say, okay, now I see where this anxiety is coming from. Now I see why this child can't do better in school. Now I see why you guys have gotten divorced, right? So you want a therapist who has a specific set of lens to see you through. Any therapist that you're going to see has what we call a theoretical orientation. And what that means is we have been trained to look at clients through a certain viewpoint and worldview and perspective. So you want a therapist who sees you through the eyes of trauma. If you don't have a therapist who understands the lens of trauma, then therapy is going to be a little rough and maybe not even beneficial at all, okay? And the last thing that I want you to focus on when looking for a trauma therapist is someone who has had years of experience providing that kind of trauma therapy, right? Anybody can claim to be a trauma therapist, but are they certified? And if they're certified, did they just get their certification yesterday? Did they get their certification 25 years ago? Did they get their certification 10 years ago? Whatever the matter, you want to look for a trauma therapist who has not just certifications and qualifications and paperwork, but you want to have a trauma therapist who has experience. Trauma is a really in-depth, convoluted, emotionally stimulating piece of work, okay? Trauma work. And so you don't want to have a trauma therapist who struggles with that, right? You want a trauma therapist who gets it, not just somebody who has a piece of paper with their name on it, but somebody who has experience in seeing you through their trauma lens, someone who has experience kind of molding and making the therapeutic experience healing for you. You want a therapist who can do that. And if you ask me, that kind of a therapist has experience. All right, guys, so thanks so much for being with me today. That was a pretty short video today, but I wanted to kind of give you some tips to close up the week. So stay tuned for Monday. We're going to be talking a little bit about how to deal with an individual who is struggling with trauma, and how loved ones, friends, families, co-workers can actually set the person back in their recovery. So I want to talk a little bit about that on Monday. But in the meantime, guys, if you have any questions or you have a topic that you'd like me to discuss, I ask you to post them in the comment section below. Hit the subscribe button if you want to keep up with videos that I post every Monday and Friday. But other than that, guys, I wish you all the best, and I'll see you real soon. Bye-bye.